Hey everyone, it's Steph. We all know the feeling, a little indigestion after a spicy meal, maybe some heartburn after one too many cups of coffee. But what if those symptoms become more frequent? What if it's more than just a passing discomfort? Today we're diving deep into the world of gastritis. Gastritis is an inflammation of the stomach lining which can occur suddenly, acute gastritis, or gradually chronic gastritis. This condition can lead to a range of symptoms that may vary in intensity and duration. Understanding the signs and symptoms of gastritis is crucial for early diagnosis and effective treatment. Here we will explore 8 common signs and symptoms associated with gastritis in detail. Let's talk about the most common symptom: abdominal pain. With gastritis, this pain tends to linger. It can feel like a gnawing, persistent discomfort, often worse after eating. You might feel it just below your ribcage, right where your stomach is. Sometimes this pain can radiate to your back or even your chest. Along with that nagging pain, you might also experience nausea, that queasy feeling that something's just not right. Gastritis can sometimes go hand in hand with vomiting. If you're vomiting blood, or if it looks like coffee grounds, that's a sign you need to seek medical attention immediately. These could be signs of serious inflammation or even bleeding in your stomach lining. Ever feel like you're constantly full and bloated even when you haven't eaten much? That's another telltale sign of gastritis. Bloating is that uncomfortable feeling of fullness and pressure in your abdomen. You might even find yourself burping more often. It's like your food is just sitting there, not digesting properly. When you're dealing with constant pain, nausea, and that perpetually full feeling, it's no surprise that your appetite might take a nosedive. With gastritis, this loss of appetite can be persistent. It can lead to unintended weight loss and even nutritional deficiencies if it goes on for too long. If you're noticing significant changes in your weight or your relationship with food, talk to your doctor. We've all had the hiccups. They're annoying, they can be embarrassing, but usually they're harmless, right? Well, sometimes persistent hiccups, especially those that just won't quit, can actually be a symptom of gastritis. If you see blood in your vomit, it might be bright red or look like coffee grounds. That is a serious red flag. Similarly, blood in your stool, which might make it look black and tarry, is another sign that something is wrong. These are not symptoms to wait and see about. If you experience either of these, please seek medical attention immediately. Chronic fatigue, that feeling of constant exhaustion, can be a sign of underlying health issues, including gastritis. When you're dealing with constant discomfort, nausea, and you're not able to eat properly, your body is under a lot of stress. We've all experienced heartburn at some point, that burning sensation in your chest or throat, sometimes even a sour taste in your mouth. When your stomach lining is inflamed, it can cause stomach acid to back up into your esophagus, leading to that burning feeling we know as heartburn. So we've covered a lot today, and I know it can be overwhelming to think about all these potential symptoms, but remember, knowledge is power. If you're experiencing any of these symptoms, especially if they're persistent or severe, please don't hesitate to reach out to your healthcare provider. Early diagnosis and treatment are crucial for managing gastritis and preventing any potential complications down the road.